I am simply honored and humbled to have been asked and present here with you all for such an important occasion, an important day, not just for me and my people culturally, but I think for our country at this particular time. So I'd like to thank them. Before I get started, my mentors back at Indiana University often reminded me that where we come from is so important, and the wisdom of my people, those of African descent who were brought into America, it is always important to ask an elder to begin to give remarks. So can I just have a go ahead or proceed from one of the elders in the room? Thank you. That's important. I was raised right, some would say. They asked me to talk about the crisis in education this morning, and when Nakia gave me the topic, I thought to myself, I can talk about suspension rates and how our youth of color in our education system are being penalized and all of that. And then we swore in a new president and all this craziness started happening. So I've kind of altered my talk today to include more so some reflective remarks about what is happening and what could happen, not only in our country, but to specifically talk about here in a community that we call Syracuse, which has become my home over the past 2 years. In 1903, W.E.B. Du Bois, scholar and Black American activist, asked a very important question in his book, The Soul of Black Folks. He asked, how does it feel to be a problem? He wanted the Black community to reflect on the way that they were being perceived in America, not as citizens, not as legal claimers to the land that they helped to build and create, but were looked upon as a problematic source for systems of education, of economics, and of society, right? And so when they gave me the topic today, a crisis in education, the question came back to me, because if we have a crisis, then there must be a problem. And so therefore, what is our problem today in education, more specifically higher education? I've spent the past 10 years prior to coming to Syracuse working in higher education on a campus similar to Upstate Medical, Indiana University, Purdue University, Indianapolis, where the Indiana Medical School is. I've taken classes with many med students that were interested in exploring research rather than practice, or interested in becoming administrators at institutions such as these. And we had many a conversation about what is the crisis in education. And so while organizing my thoughts today, as I mentioned, I watched a little bit of television, not too much, read a plethora of Facebook posts, and engaged in many critical conversations with friends, colleagues, and peers who would agree we're in a bit of a crisis here in America. The problem still seems to remain that it's centered in and around race, culture, and ethnicity, and the differences that lie within. If you aren't sure what I'm talking about, as my mentor, Dr. Robin Hughes, would say, let me just remind you of some things that have happened over the last month. A selection of a potential Supreme Court judge, the firing of Sally Yates, the selection of the next possible Secretary of Education, A women's march happened in Washington, one of the largest gatherings in recent history. A new president was sworn in. Protests around our nation and the world to speak out about a ban on Muslims from 7 specific countries. The woman who accused 15-year-old Emmett Till for whistling at her in the late 1950s has finally come and admitted that that was not necessarily true, him whistling at her. The release of a film, Hidden Figures and Fences, has made box office history. And last but not least, we have had several incidents of killing and violence here in the city of Syracuse, and that's just 1 month into 2017. So today, on the 1st of February, as I'm standing here offering to open Black History Month, talking about the contributions of my people and the pride of African descendants around the globe, it has become really important that we think about the crisis in education and what stories we are teaching our children. Where are they finding their voice and their place in the classroom? How is it that they can articulate their views and their ideas about what's happening in our country right now and how they're making sense of it? Where are we creating that space? Before I can go deeper into the crisis in graduate education, I think it's important that we begin there, because if we are not investing in alternative and counter storytelling and counter curriculums for our students, say even here in Syracuse, then how do we even get those individuals here to Upstate Medical University or other institutions like it? How many of the textbooks, lessons, subject matters that we expose our children to are infused with the narratives of difference? How many include Black researchers, scholars, physicians, nurses, or engineers? How many of the neighborhood schools are discussing the 15th Ward protests and the history of anti-slavery in our own city? Better yet, in light of recent political actions and the stance that our government leaders are taking against immigration and healthcare, how will that impact a city who just a year and a half ago was deemed one of the poorest for Blacks and Latinos in our nation? I'm talking about Syracuse, if you don't know. As we think about the crisis in education, we must think about what problem and what mainstream America is defining as a problem in the position of our traditionally marginalized groups, Blacks, Latinos, refugees, immigrants. How are they placed within that conversation? How is their experience being vocalized or being considered at at policy tables or tables where practices are being determined and approaches and strategies are being developed? Who is sitting at those tables? Okay, y'all hear me? I think so. Am I making a little bit of sense? Okay. Where the crisis begins and the challenge exists is in defining also what we call education and how we think about it. Scholars such as Bell Hooks, you'll see in my, oh, we didn't even start the little slideshow. But in the slideshow, there are images of scholars like Bell Hooks, Paulo Freire, teaching in pedagogy of the oppressed, and Gloria Latson Billings, who are critical education scholars, but have dedicated their careers to understanding how to address the experience of the Black, Latino, poor, and oppressed in American education. But are we utilizing those scholars? Even here in institutions such as the medical school, how are we infusing the understanding of cultural competency and difference within the professional field of medicine as we're preparing our future physicians, our future medical researchers, our future nurses, and so forth and so on? Oftentimes, you know, these narratives and stories that we see, if you've seen the film Hidden Figures, oftentimes it is these stories that don't get told, and we lack an appreciation for how the stories of our past can really empower students when they're sitting in the classroom, like myself, being one of very few that look like me or can relate to my experience. I think that's a critical point to consider as we think about the crisis in education. Each of these stories, prominent scholars offer insight on how to deconstruct the norms of education and present a more appropriate approach in a time such as this. Today, I'm a figure of inspiration to what I imagine is a large group of individuals around the country and the globe when it comes to education. I will say being deemed part of the Great Eight has really, it went from, let me just say this, it went from a Facebook post because our institution said that the story about 8 little black-faced girls isn't news. And so we don't see the importance of putting that on our university site. And so one of my dear friends made a little rant about that on Facebook, and it was totally out of her character to do so. And we went to bed, you know, sending text messages and talking and Marco Poloing about our feelings about the response from the university. And we wake up the next day and the White House is calling because the community said that the story of these 8 black women, these 8 young women from inner city areas really is important, right? And that's the key part that really humbles me about being deemed a part of the Great Eight. This wasn't some initiative that I started and, you know, we campaigned for. We made a Facebook post and it was shared over 30,000 times. And that has led us to talking with the White House Commission on Education for African Americans, Ebony Magazine, Power 100, and I say that not to boast about me or my colleagues, but how critical and important it is for other youth of color, Black, Latino, and other, to see folks like myself and the students that are in this room and the administrators that are in this room and the community workers that are in this room, see them and understand that we care about their experience and we know what they're going up against. And that is one of the most important solutions to the crisis in education. So last May, as I walked across the stage of Indiana University in acknowledgement of earning my degree and my mother waving and carrying on, she was really excited. My mentor reminded me, that's great, but your work is just beginning. This isn't the end of a road, but it's a very important and critical start. And my mentor says a lot of things like that. And I often go, okay, we'll see what that looks like. And then, you know, we turn on the television over the weekend and see the executive orders coming down and how that would impact not necessarily me, right? Because I somehow got citizenship, you know, from my folks being enslaved here, but for friends of mine. I've studied and taken students to study in Haiti, in the Dominican Republic, in London, and Costa Rica, and traveled all over the world, and part of my research looks at international experiences and how it impacts students of color. And so understanding how this is impacting friends and scholars that are in this country and looking to do good work, and how that, how these things are going to impact the future research was really, really personal and touching for me. And so when I thought back to the words of my mentor, I realized, well, no, I can't just lay back and kick up my heels and call myself doctor when the time comes. It's time to roll up my sleeves and get to work. And that's another important, I think, solution for many of us that get it and understand it and have the ability and the titles and the position to push the envelope. If we haven't pushed before, it's very important, I think, that we push now. Someone asked me about Black History Month a few minutes ago, and I said, you know, I spent a lot of time studying the speeches and memorizing I Have a Dream and watching Eyes on the Prize growing up. And I think the difference in this Black History Month for me is not sitting around and just learning, but acting on behalf of all those figures that acted before me, because it's on their shoulders that I stand. So now that I've gone off script, let me find where I was. So yeah, we talked about the last 7 years I've studied higher education, how to uplift and help students of color matriculate, doing work nationally and internationally, preparing students to not only be very passionate people, but to also be critical thinkers, servant leaders, and global leaders. Now, my son often reminds me or challenges me, how am I a doctor if I don't practice medicine? And I try to explain to him that there's other ways to be doctors and the social sciences and all of that. And I think one of the things that I try to explain to him is that I'm a doctor of a community, and how do I get communities to come together, organize, educate themselves, and contribute to American society in a very critical and real way. Therefore, I explained that to my son, and my comments here today stands on that experience. So since leaving Indiana University and joining Syracuse Connections and the community of folks in Blocka, Jubilee Homes, and so many other organizations that are out there aiming to make a difference in communities here in Syracuse, my staff, there's 11 of us plus our interns who are here today. I say that we have to band together, because this crisis in education doesn't start in the classroom. It starts in our communities. It starts with each one of us, and it starts with a commitment for us to, again, stand up and act and do what we know is right. In closing, I think I want to say that I'm honored again to be asked here today, and I want to challenge those that are here in this space, like Miracle Rogers, who we are of no relation, but I am honored to be here with you as a dance minor as well in undergrad. Beautiful, beautiful, beautiful. So they must have known. I said, I appreciate the arts so much. But I say to folks like Miracle, to the women that were up here and beautifully recited and interpreted the Black National Anthem, to the administrators in the room, to the staff members in the room. And when I say staff, I think I'm not just talking about the folks, the professionals that are sitting behind the desk. I'm talking about also the folks, the custodial staff, the folks that are in here when the students are gone, making sure that classrooms are set up and the floors are swept, and all those stories, right, of the people. Upstate is a lot older than I am, but the folks of color that have come through these halls and built this institution, and so many others in this community and others, we take the time to hear their stories. We take the time to infuse their stories into our research, into our efforts as healthcare and medical or community public health workers, because it is their voices, it is their experiences, I think, that is going to help us deal with this crisis in education and make sure 20, 30 years from now, this room is filled with just as many people, just as diverse, just as empowered as you all here today. So thank you, and I look forward to working with you all.
We just wanted to present Dr. Rogers with this certificate of appreciation for her words this afternoon, and then also give her a small token of our appreciation on behalf of Upstate. Thank you. Thank you.